So a public health nurse is different from the nurse you see at the doctor's office or in the hospital or in a long-term care facility in that we do very limited hands-on. Now, in public health as an umbrella, we do immunization clinics, we follow up with clients who have tuberculosis or other communicable diseases, and then there's programs within public health such as maternal child adult health, where they follow pregnant women and newborns, making sure they're growing and getting weight. So we're handling babies and weighing them and doing education. And education is primarily the biggest part of what public health nurses do. And as an overall public health nurse, you could be educating on anything from dental preventiveness to medical preventiveness to behavioral health, just everything you can think of that a nurse in the hospital might do, depending on what floor you're on. Under aging and adult services, in particular adult protective services, what we do is we get assigned referrals for concerns that have come in from a variety of people. Could be law enforcement, could be medical personnel, could be the next door neighbor. And they will say, hey, we're concerned about this elderly person. They haven't been to the doctor, or we see that they're not remembering stuff. They're leaving their door unlocked. We found them wandering. And so what we do is we go out and we assess that client. We introduce ourselves, and we do something that I learned is we call it talking story. And so what you do is you build a relationship with this person in this neighborhood, in the community, and you learn about what their challenges are. You probably learn about their family, because people start talking, especially elderly, they want to tell you their history. And so you listen to the history, you learn about their challenges, you learn about their support systems, you learn about what they're frightened of. And that helps us determine what kind of resources would be helpful, whether it's medical, whether it's social, whether it's possibly Meals on Wheels, just all the different resources that we have in this county. And that's what we do in adult protective services. We don't take people out of their homes. We don't take them to a facility and have them placed. That's not our job. Our job is to help people in the community continue to live independently as best they can. And so we want to get support services in there. And that's what we do in aging and adult services, adult protective services.